This is Rob Eirich, Nebraska Extension Beef Educator and Director of the Nebraska Beef Quality Assurance Program. Today we're going to visit about the Veterinary Feed Directive. All producers, livestock producers, will be affected by the Veterinary Feed Directive starting in January of 2017. So today we're going to review why we have the Veterinary Feed Directive, define stewardship and judicious use, talk about veterinary client-patient relationship, and talk about stewardship plans and how the VFD is going to affect us in our industry. When you look at public perception, some of the things that come up of why we need to have a better regulation on veterinary feed directives with antibiotic use in livestock, a lot of our public sees things such as antibiotic resistance and the effects of these products and these resistance on human health. They also see an overuse of antibiotics, what they perceive to be an overuse by the simple tonnage we use in the livestock industry. They also see labels saying that all we use these antibiotics for is for performance improvement within our industry. They also believe that there's antibiotic residue in their food supply. As we look at this within our industry, we know that resistance is a risk when we start looking at these products, but we also know that it's a natural risk that also occurs in human medicine use as well. We also know that if we have healthy animals that we treat properly with a proper diagnosis and treatment plan, they will perform better. Therefore, they will have performance improvement within the industry. We also believe that when we see antibiotic usage, we know that food is tested, we know that we have withdrawal time, and we follow those withdrawal times. So again, our public perceives us as making sure that we need to understand that we need to use these products better. But when we start looking at how we use these products, we have to remember education is going to be the key for us as producers, but also our consumers. With only having 2% of our population involved in production agriculture, 98% of our consumers have been removed from agriculture for 2 or more generations. When we look at this chart from the USDA and the Food and Drug Administration, FDA, this is a chart that shows the use of medically important antibiotics within the livestock industry. When we start looking down the list that they have listed here, we see a percent of each one of those that makes up the livestock usage. And we have to identify tetracyclines as being the very top one at 71% of the antibiotics we use are tetracyclines. We also need to look across the table when we look at percent of change from 2009 to 13. We also had an increase in tetracyclines by 24%. We also have other products that we've seen increase in usage on. What we really need to be concerned with when we start talking about this and how we interpret this chart, people see us as increasing our usage, but we also have no identification by these numbers on the amount of product used, on how many animals are used, and by the weight of those animals, because weight will determine the dosage of what we use. And so again, this is a challenge that we have when we interpret charts like this, but when perceived by our general public, the chart shows that we're overusing some products and we increase using more product. And so again, we have to be considerate of how we interpret this chart. The next chart shows antibiotic resistance. This comes from the Center of Disease Control. When you look at it, it talks about when the antibiotic resistant was identified, but also it talks about when the antibiotic itself was introduced. 2 things that I want to actually pick up on. Penicillin was introduced in 1943. Resistance was identified in 1940, 3 years prior to that introduction. Tetracyclines were introduced in 1950 with resistance identified in 1959. This is actually a natural occurring process. We know that if we use low rate products, or low rate of a product over a long period of time, we increase the risk of resistance. We also, by not using the product properly, we show risk for resistance. There's also some concern with if you don't follow the complete protocol that we have resistance that could occur as well. And so when you look at all that, that is just not in the livestock industry, that is in human medicine as well as animal health. And so we need to be very concerned with that to make sure the products that we have are effective in our scenarios as well as human medicine. So we need to follow things about and look at animal health and antibiotic stewardship. Stewardship is what we really start talking about when we start talking about utilizing these products to maintain a good herd health program. I want to focus on the red sentences here when we start talking about stewardship. It's a selection of optimal antimicrobial drug regimen, dosage, duration of therapy, and route of administration. We also want to select products that are identified for the proper usage to eliminate the selection of antimicrobial resistant strains. This also goes for when we start looking at vaccines, making sure we're using the appropriate vaccine programs as well. So when we start talking about this stewardship and we look at these two sentences as it is defining stewardship, we go back to beef quality assurance and all other quality assurance programs, and these are the things that we've been talking about since their inception into usage in best management practices back in the 1980s. Again, we must continually follow stewardship and understand that. We also need to define judicious use where we're maximizing the efficacy and minimizing resistance. And therefore, we're using things properly only when they're needed. Some guidelines by Dr. Jeff Fox at the Nebraska Cattlemen 2015 annual meeting, he defines it in 4 words: timely. Are we diagnosing things early and properly? Making sure we get on top of them and diagnose them early and identify them early. That way we can treat them early on in their cycle. Are we using these products when they're needed? Are the animals sick? Are we seeing signs of the disease? Usually that is identified by animals' temperature of being over 104 degrees. Again, identifying them and when it is needed to use the products when they're needed. Are they effective? Are they the proper product labeled for the proper diagnosis? Following those labels is also important when we start talking about legal. Use the proper products that are effective on that diagnosis and follow the USDA FDA approved label for those products when we start using them for treatment. Again, judicious use is nothing new. We just got to make sure we continually stress and follow those scenarios. Probably the number one priority that producers need to be working on prior to January of 2017, if you haven't already been working with this now, is developing a valid veterinary client-patient relationship. This relationship is key no matter what we're talking about, but becomes more important as we start moving into the Veterinary Feed Directive. This is a working relationship with your veterinarian. That way he or she understands the operation when we start talking about what our operation goals are, how our operation is ran, and what the risks might be for animal health. They also help us develop a herd health plan on protocol when we start talking about vaccinations, looking at what vaccinations are available that might help us to reduce the risk of some of the diagnoses that we might encounter through the year. They also might be able to help us in developing plans to maybe using alternative methods such as probiotics, mineral programs, those type of things to help eliminate some of the risk. They are also part of being assisted in developing a diagnosis for things that have occurred or that you are seeing in your operation. Making sure they develop a treatment protocol for that diagnosis that's the proper protocol with the products that are labeled to treat that certain diagnosis. It also requires a veterinarian with this relationship to have oversight on how these products are being used, making sure we are doing things properly, and to follow up when treatments are being when treatments are being issued and seeing what the outcomes are to make sure we have the proper outcome with these certain diseases and these diagnoses. Again, this is number one priority. Producers should be having this relationship and develop a relationship with that veterinarian now. There is actually a form that might help you when you work with your veterinarian to develop that valid veterinary client-patient relationship on the BQA website at bqa.unl.edu. Let's talk about the Veterinary Feed Directive. What is a Veterinary Feed Directive? A VFD is a written order by a licensed veterinarian in the course of their practice approving the use of a veterinary feed directive product. So it is a valid written order, whether it be paper form or electronic version of that form, by a legal licensed veterinarian within the state your operation is operating in, and these cattle are being treated at, for products that are feed-grade antibiotics that will be fed via the feed supply. This valid signature of veterinarian, whether it be the paper or the electronic version, must be by the veterinarian. It cannot be issued by a veterinarian's technician or a clerical staff member at the clinic. It has to be signed and approved directly from a licensed veterinarian before you can purchase and utilize that antibiotic in the feed grade in your operation. Now let's look at the timeline. The discussion has been going on within the FDA and USDA for a number of years. But starting June of 2015, FDA required all feed manufacturers to eliminate performance claims off of feed-grade antibiotics. They had to resubmit these labels without any performance claims on them. Those were being submitted starting in January of 2016. They were beginning to be approved, and those labels were starting to appear and be available on products in 2016. Starting January 1st of 2017, all feed grade antibiotics will require a veterinary feed directive before they can be utilized in any livestock industry. Also, January 1st, any antibiotic that is delivered via the water supply will be required to have a prescription from your veterinarian to do that process. Again, January 1st of 2017, all feed-grade antibiotics will require a veterinary feed directive. This will not affect any injectable products, and it will not affect some of the things such as ionophores and parasite control products, and we will list those shortly. When we look at a veterinary feed directive, here's a template that was put together by the American Veterinary Medicine Association and can be found on the Veterinary Feed Directive tab at bqa.unl.edu. What will be on that veterinary feed directive will be the veterinarian's information, name, address, phone, the client's name, address, and phone as well, but it will also have what product this directive is for, at what level it's to be fed at, for what duration of time. It will also list the species and the class of animals that the product is fed to, and the indication or diagnosis for the use of this product. It will also identify the number of head that will be treated with this product. Now, this will have a valid signature and a expiration date of the VFD. How long is this VFD good for? Some products on the label, it will be a short duration that the VFD will expire in. Other products will have a longer duration that these products can be fed in. Most of our antibiotic products, such as CTC, OTC, those type of products, will have a window approximately of 45 days or shorter. Some products like Thailand might have a duration of 120 days or a 6-month period. How this is written will be when the date is that you will be starting the treatment and when the last date that treatment can be fed. And again, that's kind of the challenge that we have, and as we manage this, we will become more confident in how these VFDs will be written and how producers will follow these VFDs. Now, a VFD can be written by a veterinarian for 3 things, 3 uses: prevention, treatment, or control of disease. Prevention is when there's a known risk of a disease occurring. Currently, none of the animals are showing signs, but the risk is high. That product can be administered to prevent that disease from occurring, as labeled on the product. Example would be you're weaning calves. You can actually have a VFD for CTC, for bovine respiratory disease, which might be a high risk at that period of time when you're weaning, to help prevent that disease from occurring. Again, you have to work closely with your veterinarian to develop those type of protocols. A treatment will be when the animals are exhibiting signs of the disease or diagnosis. Then you can treat that animal. Control of disease is when you have animals that are exhibiting signs of that disease and you are wanting to control it from spreading to other animals within that location. Again, it comes down to percentage of animals that are showing or exhibiting signs of the disease and making sure that you have identified those animals, and you could be treating those, but you want to control it from spreading to other animals. Again, the veterinarian has to determine prevention, treatment, or control of a diagnosis or disease, and that product has to be labeled to treat that diagnosis or disease. There is no off-label use of feed-grade antibiotics. What products might be effective? Those products that are critically important or highly important to human medicine that are used in the livestock industry will be affected by the Veterinary Feed Directive. Antibiotics or products that are not important to human medicine will not be requiring any type of a veterinary feed directive. This will only affect antibiotics that are in the feed grade. It will not affect any injectable type of products. Those will remain the same as directed by the FDA label for injectables. It will not affect things like ionophores, which has been a big concern in the beef industry. Anything antibiotic that is delivered through the water supply will now require prescription. What we're going to look at next is we're going to look at the products that are commonly used in the beef industry that are going to require a veterinary feed directive. Chlorotetracycline, sulfas with chlorotetracycline, neomycin and oxytetracycline, tiacin, tilmycin, and virginiamycin. Common names: aureomycin, terramycin, Thailand, Palmitil, and VMAX. These products are commonly used within our industry throughout the country, and these products will require a valid veterinary feed directive before they can be purchased or picked up and utilized within your operation. Products that will not require a veterinary feed directive that are commonly used for parasite control, estrus synchronization, for muscle development, and some coccidiosis and other types of insect control are Corid, GamePro, Decox, Safeguard, Bovitec, MGA, Rumensin, Bloatguard, ractopamine such as Optiflex, or control like Raybon. Again, these products, when you look at these products, these are commonly used. They will not require a veterinary feed directive under the current regulation. So again, making sure you're finding which products you're using and making sure that you know if you will be required to have a veterinary feed directive or not is highly important. So with the veterinary feed directive, take-home messages for our producers, stockers, backgrounders, and feeders. Start now to develop a valid veterinary client-patient relationship with the clinic and the veterinarians that you work with on a common, normal basis. Have a discussion with them on developing a herd health plan on vaccinations, treatments, and possibly looking at alternative treatments or things that might eliminate some risk of some of these diagnoses. Diagnose things properly. Follow your treatment plan. If the treatment plan is to utilize a feed-grade antibiotic, make sure you acquire a valid VFD from your veterinarian. Feed as directed on the FDA-approved label and the veterinary feed directive. Everybody must maintain the veterinary feed directive records for a 2-year period. Your veterinarian will keep the original. The feed supplier will keep a copy. The producer will keep a copy of the VFD. The producer also needs to maintain with that VFD a copy of their feed records for that product. Again, those need to be kept on file for 2 years. Following these simple steps, number one, top priority, is sit down and visit with your veterinarian and develop a valid veterinary client-patient relationship. And that is the key part of the whole veterinary feed directive to start with. You can actually find a form that might help you with your relationship with that veterinarian at bqa.unl.edu. Under the Veterinary Feed Directive tab, you will find a form that will help you to have a valid veterinary client-patient relationship. Other resources about beef quality assurance, but especially the Veterinary Feed Directive, can be found at Nebraska BQA, and that website address is bqa.unl.edu. Or you can contact myself, Rob Eirich, Extension Educator and Director of the Beef Quality Assurance Program in Nebraska. Thank you.